Next, I think I would like to invite Surabhi, one of our beans, to speak. Surabhi is our undergraduate, wonderful Bruin Beans, and she is working on a lot of health policy. And this is where I think, you know, when when you're impacted by these conditions, that she really didn't have any control. So instead of being defeated by it, she is converting it into a mission in her life at such a young age. She's only 19 years old and really working on making changes at our even at bills in legislature. So Surabhi, you want to talk a bit about your own health and the challenges and your face and how did you deal with them at such a young age actually?
Yeah, thank you so much for having me speak, Dr. Rastogi. This is actually like one of the first times I'm speaking about my health publicly, and it's something I've wanted to do for quite some time, so I really appreciate the opportunity. But I started struggling with chronic GI issues when I was 16 years old, and it was completely out of nowhere. I essentially just started throwing up one day every time I ate or drank food, and as one can imagine, that's very like surprising and unordinary, especially when it happens for weeks at a time. And both of my parents were immigrants, and none of us had had really any experience operating or working with the healthcare system. So I ended up having a very delayed diagnosis of about 5 to 6 months after I started having these symptoms, and they carried on. And I think that at the time, I never really understood the magnitude of how my mental health was impacted because again, I was 16 years old. I was a high school student and I was really just craving this idea of going back to having my previous normal life. And I think this is a very common theme that I've found out by talking to other people who have dealt with very like extreme health challenges as like young people. There's this crave to be normal, to not have to experience hospitalizations, disruption to life. And I think for me especially, I didn't really think I needed any mental health help at the time. I was under the stigma like, oh, like I'm fine, I'm perfectly okay, like this is just a temporary thing. But as this started expanding and really disrupting my life to like more and more extremes, following me into college, I realized that while I didn't have full clarity on what exactly was wrong on my diagnosis, these things were starting to weigh on me and they were starting to interfere with my relationships with people, my mood, my like happiness. And I think throughout it, there's this emphasis like, oh, like you're doing so well handling this. But I realized slowly that I wasn't actually handling anything. Rather, I was just ignoring the problems. And I think that's what really led me to like start seeking mental health help because I realized I wasn't processing, I wasn't dealing with my issues, and that was exploding in onto other people in my life. And I think realizing that really helped me because the first time I met with a therapist was when I was 16, and at the time I really was not interested in it at all. And I think when a patient is ready to take that step for themselves, there's a very big difference in how effective the treatment is. And I think by taking those steps when I was ready, I was really able to have a lot more success with dealing with my own emotions and problems. And again, like other people mentioned, there's also a big toll on caregivers. And I don't think my family realized that, but my parents also went through a lot. So after seeking it myself, I encouraged them to as well seek mental health help, which I believe helped them too. But yeah, I think another thing that really helped me, which I think CORE does a really great job of, is being around other people who were dealing with health issues. I never experienced that in high school, but coming into college, I was really fortunate to meet with a lot of people, a lot of young people who had dealt with very similar issues. Even if it wasn't the same diagnosis as me, a lot of our experiences were the same and we understood each other. And I think having that connection was really, really helpful for me because I'd been so isolated my entire time. But overall, I really wish that I had understood that mental health resources weren't just for people who have like diagnosed mental health disorders, but also for people who are just going through a really rough time in their life, whether it's physically or with other issues. And I wish I'd seek things out earlier. But thank you.
You're only 19, Survey, and you're doing amazing, amazing. Wow, that was really it's not just your journey, but also what you thought through, right? And at such a young age, and you're changing that, those challenges that you're facing into something very productive. So that was amazing. Thank you so much, Surbi. And I didn't know this is the first time you're sharing your disease, but yeah. And by GI, I just want to make sure that people know that it's gastrointestinal, right? So like I said, any chronic illness, and you mentioned that. There's one more thing a couple of things, Surbi, that I think um, just want to re-emphasize because it's important. There are cultural and ethnic differences too, right? And that then equates to stigma, right? I mean that what is a stigma attached to it. So I think that's very important. And I always say we have to meet the patients and their family where they are. And there are a lot of culturally sensitive issues that need to be handled as well. So, and I know you mentioned, and sometimes we don't think about it, doesn't happen, and it doesn't exist. And so yeah, and also the fact that we really have to separate these, you know, the mental health disorders that we commonly think about from what patients with chronic illnesses and their caregivers go through, right? I think we should always think about them as well. Great. Thank you so much, Surbi. And you're going to be sticking around, so if people have questions or comments, please do ask. So thank you. Thank you, Surbi.